That's terrific. We're ready to kick it off.
Amen.
Great to see you. Let me get us started because I know the Secretary's time is tight. Good morning to everyone. I'm Drew Altman from KFF, and from all of us at KFF and Unidos USA. Really thank you so much for being with us today. I'm personally just thrilled to have the Secretary with us today to kick off this event. It's his first KFF event, and I'm confident it's the first of many. We could have him every day of the week if he could come every day of the week, because the overlap between our agenda and his agenda is about 1,000%. The personal reason that I'm so pleased to have the Secretary is, well, I worked in HHS. My daughter, who's the Pennsylvania Insurance Commissioner, worked in HHS. More members of the staff at KFF than I could possibly list have worked in KFF in HHS. We've had two secretaries of HHS on our board, so we know the nooks and crannies of HHS. But mostly, we just have a deep appreciation for the department, and even more than that, a deep appreciation and respect for the enormity of the crazy job that you have taken on at HHS. But I would also say that we don't really think of you as the secretary. We think of you as our secretary because we're a California organization. And the secretary was a senior member of our delegation, and he was our AG. And what an AG. Before he was secretary, and he did so many things that I personally admired in health. We all know what he did on the ACA, but on protecting consumers from high healthcare costs, which has been the issue I've worked on the most my entire career. But really important, fighting for immigrants who make our state go, and so much more. So for us, he's our secretary. He's not just the secretary of HHS. I think it's the first time we've had our secretary of HHS. Just a note about today, we have truly tried really as hard as we can to step up at KFF on COVID, and especially on bringing vaccines to the communities who need it the most. And so the conversation campaigns, and the new one you'll hear about today are part of that, as is our vaccine monitor, as is our new racial equity and health policy program you'll hear about today, and many other initiatives. And I want to say that I'm especially grateful. I'm looking at them on the screen, some of them, to our partners, the Black Coalition Against COVID. But today, Unidos USA, who are just, they're not just critical, but they're indispensable to achieving our mutual goals in these efforts. The secretary made time in his crazy schedule to be here because he cares so much about these issues. And anyone who's followed him, anyone who knows him, knows he really cares about this. So on behalf of our two organizations, but also I'm sure everyone who is at this event, we welcome you. The Zoom is now under your control.
So Drew, first, thank you very much to Kaiser Family Foundation, to you, of course, as the CEO and president. But Drew, if you were recounting your history and saying really nice things because you're trying to solicit for another job back at HHS, let me just say you did a really good job, and we're ready. We're ready. We'll find a slot for you somewhere, right? All I know is that we want good people because we have a lot of work to do, good work that has to get done, and we need people who are committed to it. So anytime you want to walk through HHS's doors, know that the door will be unlocked, and then we'll lock it after you come in. To everyone at Unidos and Rita Carrion, who will be speaking principally on behalf of Unidos, I say thank you from the bottom of my heart for everything you do, always being in the right place at the right time to do the right thing for Americans, and certainly for Americans of Latino descent. To everyone at Ultimate, who I've had a chance to know forever, And to Dr. Ian Shapiro, who's here on behalf of Ultimate, thank you for every day, whether it's for seniors, whether it's for community folks who've never had insurance, just being there in so many different ways. I know you have great partners, Drew, that are working with you on this effort. And I just want to say, sign me up. Know that this little organization called Health and Human Services would love nothing more than to be a partner in this effort that you're now undertaking to help us reach, principally in this particular endeavor, the Latino community, Americans in this country of Latino descent who have not yet gotten their vaccination. We want to be there with you on this. We know that so far this week, it was announced that so far this week, more than 60% of all American adults have now at least received their first vaccine dose. And we know that we're well over a third of Americans who have gotten fully vaccinated. That is all great news. I don't know about you, but when Mother's Day came, and actually for me, because I'm of Mexican descent, I had 2 Mother's Days, right? Because it's celebrated on Sunday, traditionally in this country. And for those, at least in Mexico, my mom grew up always knowing Dia de la Madre to be the 10th of May. And so we get to hug and kiss and celebrate and have some great food that even sometimes moms will make on their own day twice. And so all I know is on Mother's Day, it was great each time to get to give my mom a big hug and a kiss and not have to worry about either contracting the virus or of infecting my mother. And so I hope that you had a good Mother's Day. I hope that Americans want to have a good Memorial Day. And I certainly hope that people take on President Biden's challenge to have a great Independence Day on July 4th by being able to celebrate together, unmasked. But to do that, we have to get vaccinated because we do know that the science has shown us and the facts have documented it, that if you get vaccinated, you are safe, at least safer, and you are a safer person for the rest of America. And we know that today, those of our grandparents who were dying early last year as a result of COVID are now living. And we know as well that so many Americans who before were not having access to the ventilators they needed no longer have to worry about that. It's a different day. And we want every American in this country to be able to relish that it's a different day so we can celebrate those very special days like Mother's Day. And so, vacúnese, get vaccinated. Help us in this campaign. If you have already done it, get your relative. Saca a tu hermano, a tu nieta, whoever it is, get them out there. Let's get them vaccinated because it's time. And we're going to make those vaccination sites available to you, to just about anyone, 12 or older. Time to get vaccinated. And so we want to send the message, es tiempo de vacunarse. It is time to get vaccinated. And there is a vaccination site near you. Probably within less than 5 miles, you will find at least one vaccination site. Community clinics, where some 50% of the people who are getting vaccinated are people of color, probably close by to you. All federally certified community clinics are now offering vaccinations. Pharmacies, many of which are in your community, offering vaccinations. Please take advantage. I know Dr. Shapiro could give you a great deal of information on that. And I know that Rita could tell you a great deal about what all the organizations that are affiliated with Unidos are doing about that. All I know is this, Drew, that working with you, there is a chance that we're going to reach many more Americans, and especially those Americans who work hard, are essential workers, are just not sure what to do, and aren't really certain how to do it. Let's give them the access. I'm thrilled to be here. Es tiempo de vacunarse. It is time to get vaccinated. I'm on board. And Drew, as I said, there's a spot waiting for you at HHS if you decide to actually come back and officially make the poverty wages that we would have to pay you at HHS. But thank you very much for letting me join you. This is a great campaign. I'm signed up. Vacúnese.
We will reach more people. This is just what we need. This is what we needed to kick off this day. So we're grateful to you. If we were in, we'll be back in it, but if we were in our Barbara Jordan Conference Center, not far from HHS, we'd give you the kind of applause, the standing applause you deserve, but let's do our best here on Zoom. Thank you very much. We appreciate it, and we'll see you soon.
Okay, thank you.
All right, thanks a lot. So now I would like to turn the program over to our VP, Samantha Artiga, who heads our new Racial Equity and Health Policy Program. And Samantha's going to take us through the rest of the program. There she is. Okay, thank you.
Thank you. Thanks so much, Drew. Thanks everyone for joining us this morning. I want to start really by thanking Drew as well as Larry Levitt for KFF's tremendous leadership on these issues, as well as for Secretary Becerra taking the time out of his extremely busy schedule to share those remarks and help open our event today. I think at this point, it is really well understood that the COVID-19 pandemic has had very unequal impacts across communities in the United States, and that Latinos in particular have taken a harder hit, both in terms of their health and their finances. Underlying systemic inequities that have long predated the pandemic left Hispanic people at increased risk for exposure to the virus, as many continued to work essential jobs outside the home that were essential for keeping our nation going during some of the darkest days of the pandemic. At the same time, longstanding inequities in healthcare access left Hispanic people facing increased barriers to accessing testing and treatment from the virus. Moreover, many of these barriers are compounded for individuals living in immigrant families who have been living in a climate of fear and uncertainty over the past several years that have made many more reluctant to access services and programs, including healthcare. For these reasons, we know that achieving a high vaccination rate among the Hispanic population is particularly important. However, the very same structural inequities that put them at increased risk and have resulted in these disproportionate impacts may also create increased barriers to accessing the vaccines. In fact, our ongoing analysis at KFF show that vaccination rates for Hispanic people have been consistently lagging behind those of white people so far across states. Recent trends suggest that we might be starting to turn a corner here, showing a sharp uptick in the share of recent vaccinations that are gone to Hispanic people, but there's still much work to be done. And today, I'm thrilled to be able to moderate a discussion with an all-star panel who's gonna dive deep into these issues. This will include a discussion of recent KFF COVID-19 Vaccine Monitor findings about vaccination experiences and barriers among Hispanic adults by Liz Hamill, VP and Director of Public Opinion and Survey Research here at KFF. Then Tina Hoff, Senior VP and Director of Social Impact Media at KFF, will introduce and debut the latest installment of the Conversation campaign to address information needs in the community. Next, we'll be hearing perspectives from Rita Carrion, Vice President of Health at Unidos, and Dr. Ilan Shapiro, Medical Director of Health Education and Wellness for Altamed Health Services. And then finally, we'll have the chance to answer some of your questions that you may have, so feel free to submit those through the Q&A box throughout today's event. But I'd like to turn now to Liz to get us started with those vaccine monitor findings.
Thanks, Samantha. I am really happy to be here today to share what we've learned in our COVID-19 vaccine monitor. This is a nationally representative series of surveys tracking the US public's attitudes and experiences with COVID-19 vaccinations. All of our surveys are conducted in English and Spanish, and we include oversamples of both Black and Hispanic adults to be able to talk in detail about some of the groups that have been disproportionately impacted by the pandemic, as Samantha mentioned. Last week, we released a report that detailed vaccine access, information, and experiences among Hispanic adults, and that's what I'll be presenting to you today. So if we can move on to the next slide. I'll start by setting the stage with what we've learned about people's intentions to take the vaccine nationally over the past 5 months. So starting at the bottom of this chart, back in December, before the vaccines were available to the public, we found that about a third of the public said they would get the vaccine as soon as it was available to them. And another 39% said they would wait and see how it was working for other people before getting vaccinated themselves. If you follow those bars upwards, what you see over time is that as more people saw their friends and family members get vaccinated, those darker blue bars started to grow. So the share of people who said they had already gotten the vaccine or would get it as soon as possible went from about a third to 64% in our most recent survey. At the same time, the share that said they wanted to wait and see how the vaccine was working got smaller over time, from 39% to 15%. But what really hasn't changed much over time, however, is the size of those green bars. So since January, between 6 and 7% of the public overall have said they would only get vaccinated if they were required to do so for work or other activities. And between 13 to 15% said they would definitely not get vaccinated. If we look at the next slide, we can start to dig into how this trend looks by racial and ethnic groups. And if you look back in December, Black and Hispanic adults were much more likely to say they would wait and see than to say they wanted to get the shot as soon as possible, while white adults were more evenly divided. But over time, enthusiasm for the vaccine among Black and Hispanic adults has grown. And by our latest survey in April, 64% of Hispanic adults said they had either gotten at least one dose or would do so as soon as possible, about the same share as white adults, with Black adults only slightly behind. On the next slide, though, we see some of the data that Samantha mentioned that her team has analyzed. And we know in those states that are collecting and reporting vaccination rates by race and ethnicity, the people who are Black and Hispanic continue to lag behind those who are white and Asian in the share of the total population that's received at least one dose of the vaccine. So this chart is based on total population rather than adults. So the numbers look a little bit different than what we see in our survey. But as of May 17th, in 41 states where data were available, 30% of Hispanic people had received at least one dose compared to 42% of the white population. So if we look at the next slide, there's clearly work to be done to address those ongoing gaps in vaccination rates. But here's where I think our survey points to a real opportunity to make progress with the Hispanic population. This is another version of that first slide that I showed, but it's just among those people who have not yet gotten at least one dose of a COVID-19 vaccine. And what you see is that among those who are unvaccinated, 1/3 of Hispanic adults say they want to get the vaccine as soon as possible, which is twice the share as among unvaccinated white adults. And this means that there's a large group among the Latino population that is already convinced of the value of the vaccine and is ready to get it right away, but they may just be facing barriers in terms of access and information. And if we go to the next slide, again, Samantha mentioned, this is again from the analysis that her team put out, we can see that some of those eager people appear to have been going out and getting the vaccine in the last few weeks. So if you look at the middle column here, you see the racial and ethnic breakdown of those who received the vaccine between May 3rd and May 17th. And you see 24% of those people are Hispanic, much higher than the shares who had previously received a vaccine. So there are some signs that this is starting to trend in the right direction, but we know there are remaining barriers to be addressed, and our survey findings can help determine what those are. So if we go on to the next slide, we see what some of those barriers might be. Here you see a variety of things we've asked unvaccinated people about that might be concerns when it comes to getting a COVID-19 vaccine. And I'll walk through some of these in more detail, but just to start by acknowledging that across the board, some of the top concerns that we hear about from people, regardless of their race or ethnicity, is that they're concerned about the potential side effects and safety of the vaccine. So the top two concerns, including for Hispanic adults, are worries about experiencing serious side effects and concerns that the vaccines are not as safe as they're said to be. In terms of specific unknown effects, we see that 6 in 10 Hispanic adults under age 50 are concerned about potential future impacts on their fertility, and this is higher than 42% of white adults in this age range. So for many of those who have not yet gotten vaccinated, it's important to keep in mind that they're weighing the risk of what they see as unknown long-term effects of a vaccine against the risk of actually getting COVID-19. If we move on to the next slide, we see that besides concerns about side effects and safety, we find that for Hispanic adults in particular, many of the concerns that they express reflect issues of access to the vaccine rather than confidence in the vaccines themselves. So here I've pulled out two of the concerns that are related to missed work. And you can see that almost 2/3 of Hispanic adults say that they're concerned that they might need to miss work due to vaccine side effects. And 3 in 10 are concerned about missing work to actually go and get the shot. And these shares are substantially higher than among white adults who've not been vaccinated. On the next slide, we find that Hispanic adults who haven't yet gotten the vaccine are also more likely than white adults to express a number of other access-related concerns. So about half say they're concerned they won't be able to get the vaccine from a place that they trust. 4 in 10 are concerned about needing to provide documentation in order to get the vaccine. And relatedly, about 1/3 are concerned that going to get the vaccine might negatively impact their own or a family member's immigration status. In addition, 1/4 of unvaccinated Hispanic adults are concerned they might have difficulty traveling to a vaccination site. Now, all of these shares are larger among Hispanic adults than they are among white adults, but notice that within the Hispanic population, these fears are further elevated among certain groups, notably people who don't have health insurance and people who are potentially undocumented, which we determined in the survey by asking those born outside the US whether they have been granted permanent resident status. And note for this group, 2/3 are worried about not being able to get the vaccine at a place that they trust, and nearly as many are worried about potential negative impacts on their own or a family member's immigration status. If we look at the next slide, we find that the survey also identified a number of strategies that could be particularly successful at increasing vaccine uptake among Hispanic adults. So first, related to the concerns about missing work, we find that over half of Hispanic adults who are employed say they'd be more likely to get the vaccine if their employer gave them paid time off of work to get the vaccine and recover from side effects. That's 3 times, almost 3 times the share of white adults who said the same. Another barrier to getting the vaccine can be that it's just not convenient. And we found that almost half of unvaccinated Hispanic adults say they'd be more likely to get it if it was offered at a place they normally go for healthcare. And although there have been some concerns raised about the Johnson & Johnson vaccine following the temporary pause in its use, the one and done option does remain attractive for many Hispanic adults, with 39% saying they'd be more likely to get vaccinated if only 1 dose was required. And then another way to make vaccination more convenient could be for employers to offer it on site to their workers. And we find that about 4 in 10 employed Hispanic adults say they'd be more likely to get the vaccine if it were offered at work. On the next slide, we find that in addition to removing barriers, certain incentives and requirements may also help increase vaccine uptake among Hispanic adults in particular. So you can see here that at least 4 in 10 unvaccinated Hispanic adults say they'd be more likely to get the vaccine if it was required for airline travel or for international travel. And those shares are even higher among Hispanic adults born outside the US who may have family in other countries that they're eager to visit. In addition, 38% of employed Hispanic adults who are not eager to get the vaccine say they'd be more likely to do so if their employer paid them a $200 incentive. And then finally, on my last slide, before I turn it back over to Samantha, I just want to highlight one more challenge that can also be viewed as an opportunity, and that's an opportunity to fill significant information gaps that our surveys have identified in the Latino community. So for example, 4 in 10 unvaccinated Hispanic adults said they're not sure whether they're eligible to get a COVID-19 vaccine in their state, even though our survey was fielded after eligibility had opened up to all adults in the US. 29% said they didn't have enough information about where to go to get vaccinated, and about half said they were concerned they might have to pay an out-of-pocket cost to get the COVID-19 vaccine, even though we all know that it should be available for free to everyone. And again, each of these information gaps was larger among Spanish speakers, among those who are potentially undocumented, and those with lower household incomes. So there's a barrier here, but it's also an opportunity to deliver information to people from trusted messengers to help them understand where and how they can get a vaccine and ensure them they will not have to pay a cost to get it. And with that, I will turn it back over to Samantha to kick us off for our next segment.
Thanks so much, Liz. That was just a great set of information for really diving in and better understanding some of the challenges that people may be facing getting the vaccine. And in particular for highlighting how filling information needs can really play a key role in helping to boost vaccination rates among the Hispanic population, which is a great transition over to Tina Hoff, our Senior Vice President and Director of Social Impact Media at KFF, who I'm thrilled to transition to introduce and debut the latest installment of our conversation campaign. So Tina, take it away.
Great, thank you all and good morning. To help address those information needs that our research shows still exist, I'm really thrilled today to be able to share a new campaign for the Latino community that we produced with Unidos US. The conversation is presented as part of our Greater Than COVID public information response and builds on messaging we released earlier this year with the Black Coalition Against COVID and featuring Black healthcare workers addressing questions about the vaccines. This latest installment of the campaign adds more than 75 videos in English and Spanish with Latinx doctors, nurses, and promotoras to address the questions and concerns that we're hearing in the Latino community. Early on, our research showed that healthcare workers are among those the public looks to get information about the vaccines, and we're thrilled to have them as part of this messaging. In addition to responding to questions about vaccine safety and efficacy and addressing myths and misconceptions that continue around the vaccines, our healthcare providers also speak to the eligibility and access issues that Liz talked about, reinforcing that the vaccines are free, available to everyone, regardless of their insurance or immigration status, and also that help is available to navigate that process. The content is designed to be shared on digital and social media, and it's available rights-free for everyone. Through partnerships with YouTube, Google, Facebook, Pinterest, Twitter, we are able to distribute these messages widely on popular social media and digital platforms. We also are working with community partners across the country, as well as health departments, to ensure that the messages reaches people where they need it most, and are also reinforcing local responses and on-the-ground efforts. Since this is a video campaign, I think the best way to explain it to you is to show it. And so today I have one of our launch videos to share with you. As a reminder, all of this content, including all of the Spanish language videos, are available on our website, which is betweenusaboutus.org, as well as on our Google and YouTube pages. So let's take a look.
I would say the biggest concerns that people have, number one, do the vaccines work? And they do extremely well, amazingly well. And number two, are they safe?
People feel like this vaccine was developed so fast, how can it be good and safe, right? But the science was already there and the infrastructure was already there.
No corners were cut, there were no shortcuts. We did all the things that we would normally do. We just did it all essentially at the same time, and everyone was working on it. So that's why it happened quickly.
I want my vaccines to do two things. Number one, I want them to keep me from getting the illness, the disease, the virus. And number two, if the virus makes it through, I want my vaccine to save my life.
The other thing that everybody wants to understand is side effects.
You know, there are side effects for many people, so people kind of get scared about that, and I get that. I wouldn't recommend anything that I wouldn't do myself.
I'm deadly afraid and allergic to needles. I cannot, I can share that with you completely. Then I got my shot, redness, some soreness. I was not feeling that shabby that day. I had a little bit of fever, and by the next day I was done. And the second dose was the same story.
If they get those reactions, it's like your body's doing its work. It's a good thing if your body's reacting, so your body's doing what it's supposed to do.
The vaccines will not give you COVID-19. I'm gonna say that again. They will not give you COVID-19. They don't have the virus itself in the vaccine.
There's like a fire hose of information that's coming at people, and it's really hard for people to sort out what can I rely on and what's not true.
There's no microchip. No one's going to put a microchip in when you get the vaccine.
I will show you the microchip that I already have. Give me 1 second. This is my microchip. It's a cell phone. They don't need to give me a microchip to actually add me anything in my brain.
It does not change your DNA. None of the vaccines that have been out there has that capability of doing that.
Because of my own experience, already have taken both vaccines. So it makes it easier for me to talk to them and say, nothing has happened to me, like I haven't changed.
You can always ask questions. Feel comfortable to ask the questions. If you're afraid, let them know you're afraid and tell them why you're afraid, and let us provide you the information that you need.
There's a lot of doubts about families' immigration status. Will they ask me for documentation?
You absolutely can get the vaccine if you are undocumented. We know that that is not a barrier, and anyone that tells you otherwise is wrong and needs to be reported.
This is available for everybody, regardless of the immigrant status.
Getting a vaccination cannot be used as a public charge or any other limitation to someone's ability to achieve permanent residency in the future or even citizenship.
The vaccines are totally free. They're paid for by the government.
The vaccine is free. It is 100% free.
You don't have to have insurance to get the vaccines.
It doesn't matter if you don't have insurance. It's available for everyone. It's safe to do it and it works.
It's one of the most effective tools that we have to protect ourselves, our families, and going back to normal. We already have passive things, and we probably have them tattooed to our hearts. Social distancing, putting the mask, making sure that we're washing our hands. But right now, the most actively thing that we can do is making sure that we create antibodies on a safe way to protect our loved ones and ourselves.
And that's a little taste of our campaign, and I will turn it back over to Samantha, who's going to introduce our panel, including Dr. Shapiro, who is, you saw in the video, who is joining us today for the discussion.
Thanks, Tina. That was great. We're already getting some good feedback in through the Q&A box from the audience. There are some questions, again, asking about how people can share the video and if Spanish translations or Spanish subtitles are available. So if you could just remind folks about that before we move on to the panel, that'd be great.
Yeah, absolutely. There is actually a tremendous amount of content available in Spanish. We did the campaign both in English and Spanish. All of our healthcare workers are bilingual, so even better than translated English content, there is Spanish language content. All of the content is available rights free. We would love for you to use it, get it out there. We're happy to get it to you in whatever form you need it. You can see all of the videos on our website, which is betweenusaboutus.org. And you can also go to our YouTube channel, which is youtube.com/greaterthancovid, and see all of the videos there, including the Spanish language playlists.
Great, thanks so much. And as Tina mentioned, we are really lucky to be joined this morning by Rita Carrion, Vice President of Health at Unidos, and then Dr. Ilan Shapiro, who is Medical Director of Health Education and Wellness for Ultimed Health Services. And I'd like to start off our conversation this morning by just hearing a little bit from each of you about your perspectives on the campaign and why you were motivated to be a part of it. So maybe if Rita, if you can start us off, and then Dr. Shapiro would like to hear your thoughts as well.
Thanks, Samantha. And, it's a pleasure to be here today with Secretary Javier Becerra, who's been a great friend of Unidos US and just a champion in our community, and also with Drew Altman and the amazing Kaiser Family Foundation team with Samantha Yu and Tina and Liz, and working together on this project. And of course, our affiliate leader, Dr. Shapiro from Ultimed. And so Unidos US is really proud to collaborate with KFF to today's release on the La Conversación campaign. The data from Kaiser Family Foundation continues to confirm what we've known since the beginning, that the COVID pandemic has disproportionately affected the Latino community. And while we continue to experience multiple crises, not just racial and ethnic disparities of the COVID pandemic, but also food insecurity and hunger and evictions from our homes, the lack of educational progress among our children and the economic distress and trauma that have been exacerbated for our families who've already been struggling. And so I would encourage you to dive deep into the data that Liz was able to provide today. We've all seen firsthand, our communities, our friends impacted by COVID, whether it's caring for our loved ones, an increased anxiety or depression or a devastating loss of life. But today and every day, I believe that there is hope in the horizon, and Unidos believes that everyone, regardless of your immigration status, deserve the opportunity to protect themselves and live without fear or increased health risk. These vaccines give us that opportunity. As part of our Esperanza, Hope for All campaign, we are bringing trusted health information in both English and in Spanish through a multi-pronged campaign, both nationally and in local communities, working with our affiliated community-based organizations through our network of almost 300 community-based organizations, including federally qualified health centers like Altamed, and sub-networks of these partners within these partners. And what I'm talking about are promotoras, financial counselors, housing counselors, parents. We continue to do our part to share these conversations, and we must share these conversations with our loved ones, with our community members, and or our patients. And so seeing these beautiful faces, I was taking a look at it last night again, it really inspires me to continue to share our stories of how we can come out of this pandemic together, unidos, and con fuerza and strength. I miss my family, just as, Secretary Becerra mentioned of, our mothers. Unfortunately, I've lost my mother really at a young age, but I had an opportunity to host, my son's grandparents for his first communion just recently. And that was the best moment that I've had in a long time. So I do miss my family. I miss my compañeras, I work, friends, my familia at work. I want to hug my nieces and my nephews, and especially, comfort my friends and families whom have lost a loved one. I think this is really personal for many of us. And we hope that these short videos help to begin or even continue the conversation with those that touch your lives. As soon as we all need to soon get back to those moments that we've all missed and cherish. So I'm really excited to be here today and answer any questions that you may have and be part of this conversation. Thank you.
Thanks so much, Rita. Dr. Shapiro?
It has been a tough moment. And right now, I want to share a couple of things that has been passing through my mind and motivated me to be part of this. We have been reaching out a lot of the people from the community, and sometimes by phone. And we called Mr. Jose, one of our patients. And the daughter answered and Señora, estamos buscando al señor Jose. We're looking for Mr. Jose. He's not here. No está aquí. Okay. When is he coming back? He's not coming back. Like, what do you mean that he's not coming back? He died from COVID 1.5 weeks ago. And we were calling to give him the opportunity. Sorry, I'm choking because this is very powerful. We were actually calling him to get him the COVID-19 vaccine. Then I do not want to have any more Joses in my life, in our teams. And that's why it's so important to mix what we're doing in the community as community clinics. And most importantly, to do the empowerment of trusted sources of information like doctors, nurses, promotoras, to go out there and do something for our community. One of the amazing things, and that's why part of the things that I'm doing right now is that the powerful thing of vacúnate ya, meaning that we need to make sure that all of us are getting vaccinated. And we all need time. And it's okay to be afraid. And it's okay to feel that there's questions. Some of the times, because of whatever, the barriers are so big and we look at them and there's nobody that is talking our language. And by language is not Spanish, it's the cultural aspect of it. And this campaign with Kaiser Family Foundation and the synergy with other partners like Altamed, with the Secretary Becerra, with Vacúnate Ya, with This Is Our Shot, they are all combining with Unidos to make sure that we are empowering anybody that wants to talk the truth, the science. And, you know, we're here to share information. It's not educate, it's different. It's a different ball game. We're here to give options, because some of the times we're running 2 or 3 jobs. We're essential workers. You already saw the data there. We are now on the part to make sure that our strategy is to make sure that at least we're present and we're giving a fighting chance to put and make sure that they get the chance to say, vacúnate ya, making sure that they are actually pushing forward the opportunity to get vaccinated in their jobs, in their churches, at the parks. We're doing amazing things. And the most important thing is the information. Because if you don't have information, you default on the fear. I think that. And of course, you create a void. And with that void, there's a lot of misinformation boiling there. Then we need to be there and present. It's upon us to be there. We have a new mission, and the new mission is making sure that we transmit the information and give a part of forum when 2 people actually are talking. It's not the doctor, the promotora, and the dentist with the patient. No. I'm coming here as a doctor, as a physician, as a pediatrician, and most importantly, as a father. As someone that has been there on the community and seeing the suffering, mental part of it, the economical part of it. And right now, it's in our shoulders to make a difference. And we can save lives. You don't need to have a white coat. You need to be present and share. And that's the powerful thing here right now that we have entre nosotros para nosotros, with the conjunction of Unidos, the conjunction with all the other partners that we have, right? And that's why it's so important right now that you need to vacúnate ya and share absolutely everything that we have. And if you have doubts, ask us. We are here for you. Thank you.
Thanks. And I think the campaign really provides such an excellent tool for sharing the information in the way you're saying, really in language, not just in Spanish, but in language and from trusted people. Can you all share some examples of how you think the campaign can be used really at the ground level in terms of working with partner organizations to help share the information in the community? And maybe Dr. Shapiro, if you want to start this time, and then we'll go back to Rita to hear her thoughts on that.
Gladly. One of the most important things is that we have different tools on the community. We have amazing promotoras, but sometimes they need a video or something to send via WhatsApp, via the linking part, or they're giving a class, virtual, whatever, and they need like material. Then this is the material. They don't need to scavenge the internet to see if it's trusted source of information or if this is it. This is a scientifically based, unbiased information for everybody. Then that's one way that you can do it. The second one is that if you just have someone that has doubts, point them on the direction of the videos, because it's a spiral up to actually get the choices and the information that it's evidence-based. It's not like, the cheap thing that's something that just, it was close to my heart, or other stuff that we have, like infertility, that it's completely nonsense. Then all that stuff is actually answered on the videos. And we are going to be creating and being present there. And you need to create conversation. That's it. And that's, 2 specific things that we can start doing at any point. And making sure that you're repeating the good stuff. And by good stuff is the science-based information that we have.
Yeah, I like to, just ditto what Dr. Shapiro has mentioned is, the value that every single one of us have, a responsibility and an opportunity to be able to, provide these tools, these resources. Many of our Latino communities live in multi-generational families. Here's an opportunity for you to be able to talk to your child, to be able to talk to your abuela, to be able to talk to your father, your mother, your tia, your tío about this information. And I think one of the things that Secretary Becerra mentioned about You know, oftentimes we get a lot of this information in other different specters, and even I know Dr. Chapiro has seen this firsthand, and so have we in terms of the community-based organizations that we work with in many social media platforms. This information and these conversations are trusted sources. They're evidence-based. They're information to build out even more, you know, our Esperanza Hope Bank, Hope for All institutional-wide initiative, not only on the health, but the economic and educational. I think we don't function in just one lane. We need to bring everything together because many of our communities have lost jobs, have lost homes, have lost loved ones. And in order for us to really get a handle of who we are and how we are in terms of a very resilient and strong community is to be able to continue that conversation. You know, there are some very great local events that we can be able to do, you know, working with our community-based organizations, you know, the charlas with the promotoras, you know, they had a pivot, you know, during this pandemic to have these online Facebook charlas or Zoom calls and pláticas. These videos can help to do that. And at the same time, the social media platforms, you know, I think a lot of the, you know, efforts that you can be able to push out, you know, and influence it in your Facebook, you know, account or whatever it is, you know, TikTok, lo que sea, you know, I think that's just as important. It's just one tool, one resource for you to be able to do. You know, many of the things that Unidos US has also done a national and broad reaching multimedia communications efforts. You know, we have had a mobile educational tour that we partner with many of our affiliates to just educate people, you know, to be in front of, you know, una bodega or, you know, the local Walmart or the local Walgreens or CVS's and say, hey, do you have any questions about this? Right now, though, you don't need an appointment to get into and get a vaccine. How can I help you? And so this is just one part of it, you know, in terms of just a multi-pronged approach in terms of advertising, utilizing a counter misinformation campaign that we'll be launching over the next month, and in influencers. For me, I see influencers as different people. It's not just your YouTube, you know, influencer that you see, but it's also your comadre, you know, that is finding this information in another place, but this videos can be able to counter that information. And they're amazing videos. So we all need to work together to be part of this effort.
Great. Tina, did you have a few other examples you wanted to share?
Yeah, I think those were all great suggestions, and it's how we've seen the content that we've had available being used out in the world. As I mentioned, they're really designed to be easily shared. We've had stories from healthcare providers who've pulled the videos up on their phones when they're having conversations with individuals about making the decision about getting vaccinated. You can search through our library and easily pull up by different topic areas. I think Rita's suggestion too of sharing it and having conversations with the family members and people in your lives is something that we're also seeing happen more and more. We're also working with many community organizations and health departments that are doing all sorts of creative ways of getting out the messaging. We've had the video shared during health events and opening up. They're a great way to start a conversation. We have had them screened in churches as part of sermons, online sermons. We've had them screened in prisons that are using it. We can make the content available to you in whatever form you need. It's also can be easily downloaded from our YouTube page and embedded on your own sites or shared on your social platforms. And we're also working with partners like Walgreens and Fair Count in the South to create complementary community toolkits that'll work with the online messaging to help for those community health workers and others that are on the ground now talking one-on-one to individuals to give them resources so they can take it home and look at this information online themselves. And again, it can be pulled down on your phone, so it's fairly accessible for anybody who can have access to the internet, but we're also looking to bridge those digital divide gaps by getting the content into the hands of the people talking one-on-one.
Thanks. I'd like to shift a little bit now and talk some about misinformation campaigns, which obviously we're trying to combat here with this sharing of trusted information. But I'd like to hear some of your thoughts and what you're seeing in terms of some of the misinformation that's spreading, how it's spreading, and what you think are some of the most effective strategies for helping to combat those. And Liz, maybe if you can start us off with what you've seen in some of the vaccine monitor findings related to misinformation.
Yeah, we have asked in our surveys, we've tested different pieces of misinformation that we know are common out there. And we find that among the public overall, about 2/3 of those who have not been vaccinated believe in or are unsure about at least one piece of misinformation. So it's very prominent. In the Hispanic population in particular, the one that stands out as being more common, and we heard this addressed in the video, is the idea that you can get COVID-19 from the vaccine. So almost 4 in 10 unvaccinated Hispanics said that that was something they had heard and they either believed it was true or weren't sure if it was true. So that is certainly out there. The other thing we found in our surveys is that 4 in 10 Hispanics say that social media is a prominent source of vaccine information for them, and that's higher than it is among white adults. I think that's both an advantage for campaigns like this, but it's a disadvantage in terms of all of the misinformation that we know is out there on social media.
Rita, if you want to, can you share some thoughts in terms of what you've seen about misinformation from your perspective?
Sure. I mean, I think one of the biggest things and most concerning for us is that, as our nation turns that corner of the pandemic, our community faces an onslaught of misinformation related to not only the disease and how to treat it, but also the vaccines. So this is originating from the social media. It is through many of those social platforms of distrust that increases distrust in the vaccines among the Latino community. And also because of the growing, group that most likely have multi-generational family households. So, when you have this information, it spreads very quickly. It spreads quickly on social media networks. It's happening both in English and especially in Spanish. And as you saw the data that Liz presented today, most of a huge percent of the Spanish language community is unaware or still has doubts and has access to much more information from other countries. And so this is problematic in terms of, well, it could be a good thing and a bad thing, right? So these sources for us is really just to make sure that we evade, opinions, do the fact checking, ensure that, that people are not pasting false headlines or disguising stories in terms of their ownership. I think we're starting to see a lot of that. So I think for us at Unidos, we're taking that stand to make sure that we're providing trusted, truthful information. We're working with the Centers for Disease Control to lead an initiative to increase awareness and education among Latinos, identify influencers, where are they coming from in terms of who are spreading misinformation, and then to build trust about the safety and the efficacy of the vaccine, and have better digital access and quality information. I think that's just as important. And given the fact that we also have now access to the vaccines for 12 and older, the little kiddos, are looking at YouTube, they're looking at a lot of different mediums, and, forming their own opinion. And so we need to have those conversations, as parents, as tias, tios, family members, and listen to our children to see what are they learning and how can we go to our pediatrician, go to trusted messengers to make sure that the right information that they're getting is part of that.
And Dr. Shapiro, what are you seeing in terms of misinformation in the families that you're serving?
It's extremely important to know that it's not a miracle that we ended up with La Conversación with this campaign. It's the reality. They come with such an amazing source of information, and it's not about education. We're running a couple of jobs, and we need trusted sources of information to just give us, this is what we have, you decide, but at least you have a fighting chance with the information. A lot of the times they come with the WhatsApp message, then that's completely unfiltered information that, at least with WhatsApp, Instagram, we can actually measure what's happening. We can understand where we are going. With WhatsApp, it's horrible. Then one of the conversations that I always have is making sure that they have like a first aid kit when they are understanding information. Where is it coming from? Are they trying to sell you something? Is it like a scientific based thing, or is it like based on like 20 people in Mars? Like let's figure out this one. And that's the conversation that I'm having right now, to make sure that, it will get to a point that we cannot answer every question. It will be, I would love to, but my wife actually wants me home and my kids, and there's things there. Then but empowering our communities to make sure that they understand what's real, what's iffy, and what we actually know and we do not know. That's actually good, because they feel empowered, like, oh, they're giving me the first aid kit, I know how to defend myself, and at least we move forward. And you, on top of that, you have la conversación, you have the conversation, and you put them all together with, with what's happening with Unidos, what's happening with Ultimate, what's happening with Vacúnate Ya, what's happening with this shot, with HHS, and you combine that power to give the opportunity again to make sure that they're vaccinating, and that's it. And I think that's a truthful part of all the things that we need to be doing in the next following weeks, because it's not about months. We're already late. Then it's about weeks on how to empower our community to get more information.
Thanks. I love that idea of the first aid toolkit in terms of empowering people to evaluate information themselves, and that's a great idea. We've mentioned a couple of times about the recent expansion of eligibility of the vaccines to the younger adolescent group, which I think opens up some new opportunities in terms of how we're talking about the vaccines, as well as strategies to help families get vaccinated. Why don't we start again with Liz, if you can talk a little bit about what we know about eligibility among kids and parents' willingness to get the vaccines for that age group. And then I'll want to hear again from Dr. Shapiro and Rita about their thoughts on that as well.
Yeah, well, I have to start by saying our survey was in the field just before the Pfizer vaccine was authorized for kids ages 12 to 15. So in a sense, when we asked the question of parents, we were sort of at the same place we were when we asked adults in December, will you get your child vaccinated? But I think we do see particular opportunities again among the Hispanic population. So 2/3 of Hispanic parents said that they were at least somewhat open to vaccinating their kids. They would either do it as soon as the vaccine became available, or they would wait a little while and see if it was happening. And just 10% of Hispanic parents said they would definitely not get their kids vaccinated. And that was lower than among white and Black parents. So there's some encouraging opportunities there. I think what's also notable is that even among Hispanic parents who had not yet received the vaccine themselves, 6 in 10 were open to vaccinating their kids. So I think that says that there's an opportunity if they bring their kid into the pediatrician and ask a question about the vaccine, it's an opportunity to get them, again, give them the tools that they need to make a decision for themselves as well.
Great. Dr. Shapiro, why don't you start us off this time talking, how do you think this expansion to the younger age group may change the dynamics around vaccination?
It's empowering. It's amazing. Everybody's looking at it. Oh my God, no, it's a perfect moment to talk about vaccines, protection, family, going back to your pediatrician, because we have bombarded the community for a year. Like, stay in your home, don't move, protect yourself, embrace. Right now, we're telling the other way around. Like, we need to see what's happening. We need to continue protecting yourself against COVID-19, pertussis, whooping cough, MMR, like measles. We have a lot of other stuff that's happening out there than COVID-19 vaccination for kids. It's an amazing opening experience for everybody. The kids are part of this. It's not that they were on their fridge frozen for a while, for 1 year, and suddenly we're taking them out. Oh, nothing happened. They know what, they saw it, they heard it, and probably they lived it. Then this is a moment to actually make sure that we're healing all together. And we were talking about this. We were doing a lot of preventive stuff. Right now is the time that we need to punch COVID-19 forward and making sure that we're cleaning up absolutely everything, and making sure that, and we're already seeing this in India, in other Latin American countries, that there's a lot of problems coming in. Then we are in an amazing position to help us in order to help everybody else. Then this is a moment to start empowering, protecting, creating more shields. We want our kids to go to school safe. We want them to live and run and do whatever they want to do without thinking, oh my God, is it a cold or is it COVID-19? Is it this or that? And yes, it's true. The kids are doing better. They're not dying as much. Yes, it's true, it's true, it's true. But right now we're seeing long hauler kids. We're seeing a lot of kids that, 22% of new cases of COVID-19 are kids. I don't know why I'm pointing myself. I'm not a kid. I'm only 21. But we have a lot of things there that need to be talked about and share information. And I think that it's a golden moment.
Okay. Rita?
Yeah, I think it's an amazing, enormous opportunity for us to continue to center our kids as the core fabric of our families. You know, we've always done that. We need to continue to do it. And like Dr. Shapiro mentioned, we need to heal together. And this is one way for us to be able to do that. You know, whether it's a family event or an elevation of young change makers as influencers to their peers or their family, we can do this. We can do this together. You know, we know that approximately 8 million 12 to 15-year-olds, Black and brown communities are now eligible to receive this vaccine. These are 8 million kids. You know, younger people could still contract a serious cases of the virus. You know, just like Dr. Shapiro, we're seeing long COVID as well, you know, and it could include hospitalizations or even death. And among Latinos kids, you know, between 0 to 17, the CDC has noted that nearly 30% have gotten COVID. This is the highest, you know, and at one point I was seeing it back in January, it was 50%, you know, of our kids, of those that are being collected on the race and ethnicity. So it's an imperative effort for us to be able to, you know, build our future. Our children are our future. And vaccinating younger people is key component to safely opening our schools, hosting larger, you know, academic gatherings, having those soccer, football, you know, games and a number of different things. And even as we look at in terms of the Memorial Weekend that's coming up, right? Here's an opportunity. I would not hold off and wait. One of the things that I would recommend is have a conversation, talk with your children, talk to your pediatrician, listen to what their needs are and their wants are, and make sure that if you continue to have questions, you know, we're here. You know, the pediatrician is there too to help and discuss what are the options for your children. Be informed. I think as parents, we have seen our kids, you know, in a lot of, you know, depressive states or anxiety because they can't be able to go and play with their kids, or they have to wear a mask and be able to, you know, still have that fear, or seeing the potential of their own parents that they've seen them having gotten COVID. And it's not something that, you know, will happen right away in terms of us healing, but this is one step that we need to take. It's going to take a long time, but we need to do it for our children and need to do it for ourselves and for the future of this country.
And I think Tina has a few thoughts, and then I'm going to move over to audience questions. So feel free to continue submitting those through the Q&A box, and we'll be turning to those after Tina shares some thoughts.
Thanks. I just wanted to echo what was just said, and also note for that very reason, we do have, in addition to Dr. Shapiro, several pediatricians as part of our network of healthcare workers that are speaking out about the vaccine. We also have community health workers with specialty in pediatrics. We know these are questions that many people have, whether it's for children that are currently eligible for vaccination or younger children for whom adults getting vaccinated offers the protection that Rita and Dr. Shapiro were just discussing. So encourage you to take a look at that content. We're also going to be looking at adding more to help people navigate these experiences and really look at vaccines as a family experience. Pediatricians are great messengers to talk to the whole family. They have a lot of experience talking about vaccines. And so we've really been looking to bring them to the forefront to help support that messaging.
So we spent a lot of the discussion today focused on addressing information needs. Liz also in her presentation pointed to a lot of access related barriers in terms of concerns about missing work, losing out on wages, immigration related concerns, particularly if folks are being asked to provide social security numbers or government issued IDs. So there have been a few audience questions that have come in about what are some strategies that can be employed to deal with those access barriers. So any thoughts on addressing those types of barriers? Rita, maybe we can start with you there.
Sure. I think, you know, we've been hearing at Unidos US and through our network and our partners that the access barriers in terms of systemic barriers, that limit access and ease of getting the vaccine. From the beginning, it was, obviously the supply of the vaccine, and then the eligibility and the confusion of when do I go next. And what Liz had mentioned earlier in the reports is people don't know when they're up. And then also where to go. Now that we do have access to vaccines and much more access, it's important that we use community place-based approaches to make sure that, we're easing our ability to be able to support our communities. Latinos have been in the front lines making vital contributions to our country and our economy. They've been helping keep America fed and parts of the economy moving, from the farm workers to the meat processing plants to those stocking the shelves and delivering food. We need to make this easier for them to be able to take that time to get the vaccine, to be able to, if they were to have that time, away as the data shows, for our communities to be able to recover if they have any side effects. I took, one of the vaccines, and I had the opportunity to step away if I needed to. But I think the biggest thing here is ensuring that, that we're able to stand up, fight, and advocate for our communities. Many of the issues around transportation is a critical one we've been hearing. We know that this administration is opening up free rides, from I think May 24th through July or June or something, where Uber and Lyft are available for free transportation. So we're trying to do the best we can to make it as easier, increase the connections with the trusted messengers, with the providers, with the promotoras, with the community leaders. I know that oftentimes in the rural areas, you don't have the promotora, you may not have the health center or, the hospital, but there are others that are just as influential, your political leaders, your community leaders, to ensure, and we're advocating to make sure that the vaccines are available there. I think the other thing also that's super important is that, as the data proves today, that Latinos need that time to recover, right? But we also need information and transparency in the data that's being collected. What is required and what is optional when you get your shot? If we're not measuring who is getting the vaccine, we will continue to make it difficult to allocate the necessary resources. And I think that's super important. And I know that, even the data that just came out today by CDC and the Kaiser Family Foundation in terms of the critical states, California and Texas still have not provided the information on race and ethnicity in terms of reporting. How do we know we're going to be able to do the right thing? And I think it's super important for us to not only for our community to understand how important this data is, but also to ensure what our rights are as patients, as participants, that the vaccine is available to anyone for free, whoever wants it, regardless of your immigration status, and ensure that data is being protected.
Liz, can you maybe comment on some of what we've seen in terms of actions employers could maybe be taking to address some of these structural access barriers?
Yeah, I think certainly, as Rita mentioned, allowing employees to take paid time off if they experience side effects or even if they need to travel to get the vaccine. But also, I think bringing vaccines to the workplace is another great strategy. And, we tested some employer incentives. Employers who really care about getting their employees vaccinated may give them a little bonus if they agree to get vaccinated. I think those are some ways that employers could be involved. And we've seen lots of creative strategies coming from, private companies and from state governments. I think that employers could be creative too in the ways they think about encouraging vaccine uptake among their workers.
There are also some questions about reaching more isolated communities and individuals. So individuals who may not have access to broadband internet, who may be farther away from community resources or promotoras. Dr. Shapiro, maybe we'll start with you. Do you have any thoughts on strategies to help reach these individuals in those types of communities?
And yes. California that has actually gone out there with to the fields, and they bring like a couple mobile units and they just vaccinate. And it's awesome because everybody wins. We're protecting our people, our families, and at the same time, the people that are working there are protected, and not having COVID outbreaks. It's awesome for everybody. then it's a win-win for everybody. And it's making sure that we're creating those opportunities and we know where they are. We know where we're working. We know where our communities are. It's just making sure that we go one day with the vaccines and making sure that we have a plan and at least be present, because a lot of the times, if they don't have a choice, they don't have a choice, it's done. But at least being present, go like, you know what, this is the information that we have. This is the barriers. I'm here. This is the vaccine. I need a shoulder. I need a shoulder for the vaccine to work. Then creating that type of energy, and that's Oregon, that's Texas, that's Florida, that's North Carolina, South Carolina, that's California. That's it's everywhere that we have a community. It's, you know, the meatpacking companies and stuff like that. We have a lot of good places that we can create this. It's proven model. It's not like, Dr. Shapiro is very innovative. No, we already have done it. We just need to put the resources and go out there. And we have community clinics. We have, you know, mobile units. And some of the times we actually do not need the mobile unit. You just need like a special freezer, making sure that everything's protected and have the connection with everybody. And I'm very proud, you know, for a lot of the commerce groups that from Latinos that are actually trying to provoke that conversation to make sure that, you know, by the way, get your vaccine tomorrow. You're not coming. That's okay. If you feel bad, if not, welcome. And having those conversations, and that actually opens a huge deal for our, and the other thing is, and I was forgetting, with census and voting, we did an amazing job. We never voted so much. And that was because we were knocking on the doors. We had the 5-touch model, making sure that we're knocking, we're present, we're here, vaccine, and creating those movements again. It's possible. We already did it for voting and census. Why not now? Then we have a couple of interesting things that we can still cook and create.
Great, thanks. Tina, there was a question asking about any distinctions between the first installment of the campaign, which is really focused on addressing information needs among the Black community, and this latest installment of the campaign. Are there any differences in terms of outreach strategies or messages that you would highlight?
So we've been very fortunate to have access to continuous data throughout the pandemic from the Kaiser Vaccine Monitor, which is in the field every month, doing deep dives, looking at specific communities. So we really look to hear what the community is telling us that they need. And that's, of course, also been an evolving conversation as we move forward. I think some of the things we've seen are that there are some consistencies across populations. As Liz talked about, we hear some of the same questions being asked from different populations around safety, around efficacy, how we got here so fast. With the content that we've released today, focusing on the Latino community, we certainly heard a lot more too about questions about access and eligibility, immigration, insurance, cost, and made a real effort to try and amplify those messages and bring them to the forefront. Some of the misinformation and myths do seem to cut across population groups, so we continue to have those conversations. We've also seen that the messenger matters. People obviously need to hear the content in their own languages. It helps to hear it from individuals who share their experiences, who can relate to their lives and understand their experiences. And so that's a big part of why we also bring the providers from the community here. And just off of the last conversation, you know, I think the Dr. Shapiro's mention of the census and the voter outreach is a great example. We also have heard from many groups that have pivoted from that work to doing vaccine outreach. Fair Count, one of our partners in the South, is a great example of an organization doing that kind of work that is helping to take the messaging that we're producing out into the community and get it more widely seen in those rural and harder to reach areas. And I think we can work in tandem with groups like that to support their efforts.
And I want to close with one final question to Rita and Dr. Shapiro, which is really bringing us back to thinking about why equity in vaccinations and really focusing on getting vaccinations to the communities that have been hardest hit by the pandemic is so important. So Rita, maybe if you can kick us off with some thoughts there, and then Dr. Shapiro, we'll have you close us out today.
Yeah, thanks, Samantha, and thanks again for those that are on and hearing about this new launch. And the Conversación series. I think we must recognize that, you know, our community understandably have concerns, they have questions, they have doubts, you know, and our job is to help them make an informed decision. you know, we all want to get back to the lives and the people that we most cherish. And this means that, you know, pursuing the steps rooted in community and in culture and, you know, inclusive to the voices that, like we heard today, and the faces that you saw today, you know, I would encourage you to go and listen to every single one of them and their stories. You know, this is one way for us to optimize access to vaccinations for all, regardless of who you are and where you live. You know, this is important for us to increase, you know, and earn the trust of our communities. We need to have optimal health. We've got a number of different partners that Unidos US is working with, you know, not only with the Kaiser Family Foundation and multiple campaigns that we're part of. You know, I have the pleasure of being a co-chair of the steering committee for the National Institutes of Health for SEAL Alliance. And there are 22 research organizations or research groups that are working very closely with community-based organizations to get the message out. So there are resources out there, there are information out there to combat misinformation, but I think every single one of us has a responsibility, you know, to be able to you know, tell our story, but at the mismo tiempo, you know, to be able to share with our compadres and our comadres, you know, the importance of you know, how these vaccines are life-saving. So as the largest Latino civil rights and advocacy organization, we believe that everyone deserves to have that opportunity and the ability to be healthy. So we must recognize that. And I just want to, you know, thank you all, thank Dr. Shapiro also for being, you know, with our patients, leading a lot of the work. You know, many of our community-based organizations are knocking on those doors, you know, taking that community organizing model to be able to support our communities, especially in those rural areas and agricultural workers that need the help and assistance. So thank you.
Dr. Shapiro, some final words. We're at time, so they'll need to be quick.
Okay, I promise you will be like 15 minutes and everything. I have my book already prepared and everything. Then on reality, I'm very thankful for being here. A lot of the times at the beginning of this pandemic, everybody was asking me, Dr. Shapiro, is this virus modified to make sure that all our communities are suffering more? Or is our genes worse than others? What's happening there? On reality, it has been decades of problems with social determinants of health. Pure and simple. When you actually stress a community, they already have toxic stress. They have problems with environment. You know, we live in highways. We have asthma. We have diabetes. We have obesity. We have problems actually to finding nutritional food sources. And we are actually working 2 or 3 jobs as essential workers. And we're exposing ourselves and bringing that present of COVID-19 to our kids. Of course, this virus will actually be hurting us more. Then everything that we're seeing right now, I hope that we learn and we see it and we picture it in a future. Because in 2009, when we had H1N1, it was the same story. Thanks God, influenza H1N1 was not that bad. It was not that bad. But right now we learn and we need to create resilient communities. We need to make sure that everybody's vacunate ya, that they are getting their shot. We're giving a fair opportunity to choose and get the vaccine. And most important right now, we need to start vaccinating our communities against fear with a dose of truth. And that's why this forum with Kaiser Family Foundation, with Unidos USA, with Altamed, with This Is Our Shot, with all the partners, having, you know, Secretary Javier Becerra coming here and highlighting the efforts that, you know, Liz is actually showing us the data, because that's clear and powerful. Having someone like Samantha and Tina and Kelly and everybody like pushing forward, and having Rita representing us in tables of people. That's the things that we need to be doing. And of course, having the tools for our community to defend themselves and protect their most loving, precious things, that it's life and health. I hope, and with this, I promise it will be my last 20 seconds. I hope that by December, we get to hug each other. We get to have a decent dinner without thinking if we need a mask. Do we need this? Is it changing? That's my philosophy, and the effort starts today. Before, we didn't know squat. Right now, we have the data, we have the vaccine, we have absolutely everything, we have the partners. It will be in our shoulders what happens on the future for our community. Then, thank you so much for the opportunity.
Thank you. I think that's a perfect way to end our conversation today. I want to thank all our panelists for sharing their insightful thoughts and their expertise. And I want to thank all our audience for attending. We hope you learned something new today, and we hope that you will find the campaign useful for your work going forward. Thanks again.